All right, and with that, let me turn to our guest, Rik Peeperkorn from the World Health Organization. Let's try to get him up on the screen. I'm sorry, our guest is up. Mr. Peeperkorn, thank you very much. We're very pleased to have with us Dr. Rik Peeperkorn, the World Health Organization representative in the West Bank and Gaza, who's speaking to us from Gaza. Mr. Peeperkorn, it's good to see you. The floor is yours.
Thank you very much. I hope you can hear me loud and clear.
Yeah.
Yeah, so very much greetings from a very cold Gaza and cold and windy Gaza. So let me focus on health. So my name is Dr. Rik Peeperkorn. I'm a WHO representative for the occupied Palestinian territory. I've been this almost for 4 years, and also before the crisis, came to Gaza every month, a week, and since the crisis, actually from November 23 onwards, every second month I've been in Gaza for a couple of weeks, sometimes 2, sometimes 3, sometimes 4 weeks during the polio campaign, etc. And I'm here now for the last 2 weeks. Let me tell you something about the visits we made, especially in the south, in Rafah, and in the north, in Jabalia. First and foremost, of course, the health needs, focusing on health, they're immense. The functional health facilities and services are scarce. We still talk about 18 of the 36 hospitals, partly functional, and roughly 1/3, 55 of the 143 primary healthcare centers, partly functional, 11 field hospitals operational. Total bed capacity is 1,900. Used to be, before the crisis, more than 3,500. And 1,370 inpatients bed and very few ICU beds and incubators. To say something about mental health, maybe start something different, is that everyone in Gaza is affected by this 15, 16 months conflict. I mean, literally everyone, including my staff, the stress, anxiety, kind of feeling of loneliness, depression, etc., all over. If you look at the number of psychiatrists, only 2 in the north, and a few mental health professionals. Before the war, mental health was already, I'd say, an issue, but there was a psychiatric hospital, and there were 6 community mental health kind of centers, and a good NGO network for that as well. That's all came to a halt, either destroyed, not working. Ceasefire, of course, the bad thing, whatever happened to us, and then allowing WHO to scale up the health response. Since that, we received, I think, more than 102, 105 now trucks coming from the north and the south. We had already stocked up on some supplies, and we dispatched supplies to cover the needs for more than 106 million people. Now, in the north, you heard probably more than 560,000 people crossed towards Gaza. North of Gaza is probably more than over 1 million now. If you look at the north of Gaza, and then we came back, especially in the months of October, November, December, WHO was constantly trying to reach, and we reached Kamal Adwan and Al-Ada, Indonesian, to bring fuel, supplies, EMTs, etc. Currently, there's only one hospital which remains partly functional, Al-Ada, with a lot of these. Kamal Adwan is completely destroyed, burned out, unrecognizable for a lot. Jabalia is like a wasteland. I mean, like the destruction is incredibly, it's beyond belief. We knew this. I mean, I've been there so often, but when you see it, it was a beautiful sunny day, and when you see that around you, it's a wasteland. This hospital, the other hospital there, Indonesian hospital, not functional. The infrastructure more or less intact. For the rest, also a lot of damage and everything gone. And you don't only talk about hospitals when you want to run hospitals, but also for example, the generators, the desalination plant, oxygen plants, etc., all destroyed. The already plants there, from the partners, the WHO, the ministry, and the partners, to some sites cleared around Kamal Adwan to get a kind of polyclinic, think primary healthcare, establish a trauma stabilization point, because people are coming back also in Jabalia. So we see people there, they come to their mostly destroyed or damaged, severely damaged houses. They put up a kind of makeshift shelter, children, women, men, etc. First thing, of course, they need is shelter, wash, but also lead like this basic health facilities. Gaza City is, of course, an expanding rapidly. We are trying to help Shifa Hospital. We're expanding 200 beds. What is being planned? Assessment going on for Indonesian hospital to help and restore its restorations. And also we try to get in a prefab facility for Gaza City. Surgical teams already deployed actually in Al Ahli and the public aid hospital. It's impressive, by the way, and something positive if you go to Shifa Hospital. And we all know that all these hospitals, they became non-functional, nothing happened, that they bounce back. It's in the middle of the severe destruction. Some departments are working, and it's working again as a referral hospital. So we support an emergency medical team, a national emergency medical team. There's general surgery going on, trauma surgery going on, and mother and child health, ops and gynae, etc. So a lot is going on. And also some substantial renovations to expand the inpatient departments and the ICU. Disease surveillance, we need to really expand now, and the whole area of public health intelligence as well. Then let me say a few words about Rafah, because that's of course another area where people could go back to. And so also Rafah, the buildings are smaller, and so it's that sense, but it's the same scale. It's the same kind of wasteland as in Jabalia, wide-scale destruction, and it's mainly from residential buildings, including, by the way, our WHO guest house. The bedroom, I recognize my bedroom, is completely flattened. I don't understand. It was a deconflicted building. The healthcare lifeline has been really severe. It's like in Rafah, before the siege in Rafah, we helped to take away as much as possible equipment and bring it to other places. The three hospitals there, the three hospitals, the Al Najjar, the Emirati MCH, and the Kuwaiti hospital are all non-functional. They have been non-functional all the time since then. The Al Najjar severely damaged in front, and in the back was complete mess, will be difficult to restore. The MCH hospital, that was the famous MCH hospital, which maybe remember when WHO actually transferred the 33 babies from Shifa to there. Even in that hospital, it's very sad to see the neonatology ward, incubators, almost everything is destroyed and shut out. So that maternal and child hospital, not functional. The other hospital we cannot reach because it was in the buffer zone. But also there, you see people coming back. And they, again, the same as Jabalia, camping between the ruins. So same plans for there to get a trauma stabilization point and some sort of primary healthcare. Last one, medevac. Medevac, I think, has been starting, and I think that's part of the agreement to maximum 50 critical patients daily. Now, I was on the first medevac. It's a long process. So all these days, it's not reached the 50, but like 36, 37, 38, 39 patients, plus their companions. And this is incredibly important that we expedite this and we speed this up, because we have estimated at WHO that between 12 and 14,000 patients are in need for medevac out of Gaza. Half of them trauma, half of them related to war, half of them chronic diseases, oncology, cardiovascular, etc. Of these 12 to 14,000 patients, we estimate at least 5,000 are children. So what we actually pushed all along, great that Rafah is crossing is opening, but we need to expedite. There should be more patients going through Rafah into Egypt. But we want other medical corridors. And the first medical corridors we really want to see restored is the traditional referral pathway to West Bank and East Jerusalem. The hospitals are ready in East Jerusalem and West Bank to receive the patients. Now, a few words on the West Bank, and I think it was mentioned already, concerning due to the operation also have an impact on health and healthcare. We try to do the WHO preposition supplies in key hospitals, work on mass casualty management training. We had already a trauma care program in place in the West Bank and indeed provides emergency stocks. I want to leave it there. Over to you.
Thank you very much. I'll now turn the floor over to questions. First question goes to Edith Lederer.
Thank you very much, Dr. Peeperkorn, on behalf of the United Nations Correspondents Association for doing this briefing. My name is Edith Lederer from the Associated Press. Could you give us a little broader update on medical evacuations? How many are waiting now? How critical they are? And could you also tell us the impact of the United States withdrawal from WHO on your work and what you're hearing, because you're in Gaza and we're not, from people there about President Trump's announcement that he wants the population of Gaza to be evacuated, the U.S. to take over and turn it into the Riviera of the Mideast. Thank you.
Okay, let me start with medevac. So before the Rafah crossing was closed, that was in 6 May, because I remember I was in Gaza, 6 May 2024. Approximately 4,800, 4,900 patients had been medevaced into Egypt, and from Egypt, I think 2,000 stayed in Egypt, and for the rest, a lot in the region, UAE, Qatar, Oman, Turkey, and then I think a few to Europe from there. Now, since the crossing closed on the 6th May, only 480 patients have been medevaced. That has been all managed and supported by WHO. So we did already the internal medevac from the north to other hospitals on all those missions, etc. And we brought fuel, medical supplies, EMTs. We got patients out of being on numerous of those missions to other places. 480. And we constantly raised, and that went then through Kerem Shalom and then to Ramon Airport, and then for them a lot to the UAE and to a number of other places, including some Europeans, a few to Jordan and the US. We raised already then, we have to speed this up. We will be, if we continue like that pace, we will be medevacing for the next 5 to 10 years. And in the meantime, people and some of the critical patients, including children, because they couldn't be medevaced, they were dying. So it was a real urgent plea. We also then already said we need to expand that and we need to get back to this traditional referral pathway to East Jerusalem hospitals in the West Bank. Because before this crisis, between 50 and 100 patients per day were referred to the East Jerusalem hospitals and the West Bank. That was not trauma then, it was mainly oncology. And it was oncology and a little of cardiovascular and other more complex specializations which couldn't be treated in Gaza. Now, we also had a good overview of these 480 patients, of which half, which WHO actually medevaced, of which half were children, more or less, that the major reasons for the medevac were either trauma or oncology. And then there were some other congenital diseases, etc. There were some other areas. Now, currently, the Kerem Shalom, there's no medevac anymore through that one. It's only through Rafah. And according to the ceasefire agreement, it should be 50, at least try was maximum 50 patients per day. So it was only started, it started last Sunday. I was there, I mean, and with the team. So we got to just describe that, we got one group of patients from Shifa, from the north, another group from Nasser Medical Complex, where they were collected and got them through the border. Then in my view, way too complex and long screening process still takes place there. I mean, like it takes a long time for 37 patients and their companions. It took almost 7 or 8 hours to manage that. So that's it. That also needs to be improved, and that mechanism needs to be improved and much quicker. We also stress again, I want to stress again, we need more medical corridors, and that's why we made this plea, which is not yet allowed. I hope it will be considered to get another medical corridor, for example, through the north of Gaza, through Erez, back to East Jerusalem and to the West Bank hospitals, and then you could say from both Egypt and from the East Jerusalem and the West Bank, when needed, third countries could, when they are ready to receive patients, could get the patients from there. That is the idea. We are ready for that, to facilitate and support that as much as possible. Now, you asked about a difficult question on the impact of the U.S. fundings, etc. Well, first of all, I want to say, also on a personal note, of course, that we hope that this is still being reviewed and reconsidered, because I think that the statement from the WHO has been clear, regrets that announcement of the intention to withdraw from the organization. And we need a strong World Health Organization, which plays a crucial role while protecting the health security of the world people, including Americans, addressing the root causes of disease, but also building stronger health systems, detecting, preventing, and responding to health emergencies, including disease outbreaks, often in dangerous places where others cannot go. And therefore, we really hope for this reconsideration and look forward to engaging in this constructive dialogue at all levels, which we always did. And like I worked with the US all the time when I was 7.5 years rep in Afghanistan, and now. And I even want to make this even a bit personal. Like I've been I'm a medical doctor, but I also graduated from Johns Hopkins School of Public Health. And the US has an array of really strong public health schools: Hopkins, Harvard, Emory, Berkeley, Tulane, you name it. But also we worked, of course, when I worked in the field, Africa and Asia here, a lot with CDC, very strong National Institutes of Health, etc. And that should be part of that. If you talk global health, and you talk global health security, we should focus on collaboration and not on isolation. And we need everyone on board, and specifically the US. So I really hope that somehow will be reconsidered. You ask on the direct impacts, like in OPG, we have an array of partners and donors, fortunately, with a group of 30 partners. But I quickly looked up what it would mean for example, for the Palestine territory and Lebanon. And then the US in that accounts to almost 30%, like with 67 million there of emergency, when we look at emergency operations. So that is substantial and massive. And that's just now. We are now still in the humanitarian phase, but we are already starting early recovery, rehabilitation, and reconstruction. Wherefore, much more is needed for health overall. And I think hopefully we get the figures later in the coming weeks from the UN and World Bank and the UN to really get a better overview of what is needed. So we need everyone on board. On your last questions, I find it very difficult to address and give an answer. And I think my colleague already did that. Over to you.
Thanks. Maggie?
Hi, Dr. Peeperkorn. It's Margaret Bashir with Voice of America. Thanks so much for always giving us your time. You touched on mental health at the top of your remarks. I was just wondering if you could talk to us a bit more about it. I imagine probably the entire population of Gaza has PTSD of some sort. Can you talk to us about what WHO is doing to treat adults and children who are suffering from this? And how many medical professionals are left in Gaza that you're aware of, Palestinian medical professionals? Thank you.
Thank you very much. I think on mental health, what we already, I think first of all, you're completely right. I mean, everyone is affected, But of course, some groups are more affected than others. So we have to always look to these more vulnerable groups. And the more vulnerable groups in this case are the children, I would say the adolescents, maybe women even more than men, etc. So that's one part. And then, of course, also other vulnerable groups in Gaza. But though we have to look to all, what also is a specific group are the humanitarian workers, not the internationals, but health workers. So having been working here for 4 years, and specifically in the health field, and looking at the resilience from the Gazan health workers, but also, first of all, they're all just as affected as anyone. And including myself, I think they all have witnessed scenes from incredible cruelty and which they will probably, they all will have to cope with it somehow. So also helping the helpers. So first of all, WHO, we tried to get in. Also, what was the problem? There was no, okay, the mental health hospital was destroyed, the community health centers were also destroyed or non-functional. There were very few psychiatrists actually in Gaza. It was already not the strongest area of the health field. We were just actually starting to integrate primary health, mental health in primary healthcare, also in Gaza and in referral hospitals. What was strong in Gaza on mental health, there were some really strong NGOs working in mental health with the communities and at schools, not just with WHO. I want to mention UNICEF there as well. I mean, like, there was a lot of work going on. So what has happened now? There is again the Ministry of Health, WHO, and the partners here in Gaza. They looked from the start on what is a minimum health package we can provide, and make sure that also some basic mental health is included. On some of the medical points, primary healthcare points, this is already happening, and also in some of the hospitals, for example, European Gaza hospitals, which we are supporting. We brought in the psychotropics for people who would need psychotropics, and we're constantly doing that. I mean, WHO provide almost 80% of the supply. So we did, and in health, so we also did that. Difficult to get in, sometimes took time. And also we started training programs. Of late, 44 mental health humanitarian health workers were trained on psychological first aid to provide this immediate emotional and psychological support early, and also ensure early detection and enable safe referrals, promote resilience. I know that UNICEF is doing work and with UNRWA in the schools and at least the learning centers, as it is called, as well in this area. But I think when the ceasefire holds, and that's the big thing, of course, it has to hold and transfer into a peace process. This is an area we have to tackle differently and much more creatively. And not just in the medical field. Yes, you need mental health integration at all levels of healthcare. So that is definitely an issue. And that's absolutely not there. So that will be massive amount of work. But we need to think much more creatively at schools, in communities, etc. Community approach. And we have to look really at different approaches. And of course, we hope that some of those NGOs and NGO work come back. Over to you.
And then just on the number of doctors and medical professionals that are left in Gaza after the war, what's the WHO's estimate?
Difficult to estimate, because I think before the war, there was almost 25,000 health workers. And I think I think I've mentioned, I think there was 5,000 medical doctors and 10,000, 12,000 nurses and midwives. And unfortunately, especially in the first 6 months, a lot of what I would say, the top medical specialists left Gaza. And that's why maybe you remember that we have had this horrible reflections that I remember when I was in December in 23 and in January in Al-Ahli Hospital, where you had really good surgeons doing their work and with horrible trauma all around. But they lacked, for example, a vascular surgeon. And that's why they had to do even more amputations than they normally even needed to do. And this is what you hear. Just in Nasser Medical, you meet the only thoracic medical surgeon actually in whole of Gaza. There's some other things here, like if you talk about medical imaging, you talk about one operational CT scan and maybe one MRI for the whole of Gaza. So those are really oncology. Oncology is a big issue, and I think because we focus so much on trauma, we forget the non-communicable diseases. And when it is not war, the non-communicable diseases, cardiovascular, oncology, diabetes, etc., are the biggest killers. And in that area, I mean, there has been a lot of indirect deaths in Gaza as well. Now, especially on oncology, what was also an area before the crisis, we were working on to try to establish an oncology center in Gaza. We get oncology drugs in, and there's some chemotherapy, etc., but it is very limited. There's no proper oncologist, so we try to get also specialized medical teams in, which can focus on that. For that, again, you need a ceasefire with holes and I would say a peace process. Also in the West Bank and in the East Jerusalem, there is Palestinian medical specialists who have that expertise, oncologists and others, and they are really willing to come as national emergency medical teams. We would love to see that and facilitate that. Currently not allowed. Over to you.
Thank you. My name is Ibtisam Azim, Al Arabi Al Jadid newspaper. I have quick follow-ups. You said that there are medical personnel who left Gaza, but we know also about medical personnel in Gaza who were killed by Israeli strikes directly or indirectly, and others were arrested, died in Israeli prisons. So do you have any numbers on how many people working in the medical field in Gaza were killed? And also in that context, any updates on the fate of Dr. Abu Safiyi, who is in Israeli prisons? My question is about which supplies, whether medicine, machines, whatever, you need desperately for your operations and still not allowed to get in or getting not enough in. Thank you.
Okay. I think on your first question, I think I don't have those figures now, but WHO, we have a mandate that we report on attacks on healthcare. And we do this regularly, and maybe I will ask somebody to send some of the most updated data on that. I want to make that point. So we are mandated that by to analyze and then to report on attacks on healthcare by the World Health Assembly. And in Gaza, I think up till now, out of the top of my head, we verified 670 attacks that resulted in 886 fatalities and 1,355 injuries. So attacks affected 122 health facilities and 170 ambulances. Now, WHO, we don't attribute, the attacks. I mean, where and how? Because I also want to say we are not a crime investigating bureau. We are the World Health Organization. That's the mandate we have, and we on attacks on healthcare. That's the mandate we have. I don't know. I think we have. I think WHO have often raised their concerns about all detained health workers, including Dr. Hussam, who I know personally because I went often to Kamal Adwan. And I think not only myself, Dr. Tedros, many others have raised that constantly. We have no information on that. Over to you. On the needs. On the needs, it's an array. I think it's an array on needs. By the way, I just want to say on the data I just mentioned on the attacks and the death. So this is a tax on healthcare. That is not just health workers. It includes doctors and it includes civilians as well, who there might have included patients. So we do not disaggregate and you know, and including on the nature of the injuries as well. Maybe that's, I should be specific. Now, on the health needs in every field, they are not, I would say, enormous. If you look even some areas of essential medicines, there's still needs, but I think we're doing a little better in that area. What we will really have to be working on when you talk early recovery and rehabilitation is, of course, all the building materials, etc., for that. But also, what we struggled with was generators, large generators for hospitals, and etc., the spare parts, etc. When we would move into a phase, and we all hope, pray for that, we go to the phase in a peace process, and you know, way to a longer term solution, that then we talk about rehabilitation and reconstruction. Then we also, as WHO, not only we looking which hospitals and which health facilities, etc. And there needs to be, of course, a Palestinian plan that is in the make for that, where we contribute to. One topic I can raise already, where we have to already raise now, if you look at the medical equipment, for example, medical imaging equipment, X-rays, CTs, MRIs, etc. Before this crisis, it was very complex to get anything like that into Gaza. That needs to change. If you really go on a way for rehabilitation and reconstruction, all of that needs to change. I don't know how this will be, what the reality will be in future, but that's, of course, is the plea. Over to you.
Abdelhamid? Abdelhamid?
Thank you. Thank you, Dr. Peeperkorn. One of my questions were asked about the whereabouts of Dr. Hussam Abu Safiya, and I didn't hear any concrete answer from you. But I was following a report from Al Jazeera, from Gaza, and people were complaining about many things in the field of health. First, there is no medical equipment, and there is no emergency kits. There is no tents. They said only 3% in this cold weather. Only 3% of the needed, I think they mentioned 20,000 tents or something more than that. And the availability of the medicine is not there. So my question, what about the quantity? How much you can get into Gaza of the most needed equipment and medicine? And the second, it's related to it, what is the situation in Rafah crossing? If you want to bring some supplies, who stopped the UN trucks and inspect them? Are they the Israelis or the Egyptian or the Europeans or a combination of both Europeans and Israelis or Egyptian? What is the situation on Rafah crossing? Thank you.
So on the Rafah crossing, there's, by the way, for your information, the Rafah crossing is currently only used for medevac. So it's not used, I mean, maybe you have to analyze it better. It's not used for any trucks. The trucks come in through all kind of other areas. They're through Egypt, through Kerem Abu Salem and Kerem Shalom, in the north through Erez, I think to Zikem and a number of other places. I think overall, and I'm sure that my colleague, I logged in late, but I think overall, I've seen the figure that over 10,000 trucks entered. And when I look at Gaza, I've been here so often since the crisis, and I've seen especially in the medical field, I would say, the most horrible scenes I've ever witnessed, even after 7.5 years of Afghanistan and then almost 20 years of Southern Eastern Africa. And I've seen a lot of grim scenes. However, if I look at it just as a now non-health, the food situation definitely has improved in Gaza. everywhere. Everywhere. I mean, the food situation has improved. Water is still an issue. Shelter, you mentioned, etc., and the tents. There's a lot of issues around it and should be definitely expanded. I'm not the expert on that. I think you have to raise that to maybe the shelter cluster. I mean, the issues with that, but definitely that is needs to be expanded as much as possible. On the issues on you said that medical supplies, essential medicine. Of course, there are shortages. Just want to remind you that also before the crisis, that in Gaza there was a huge shortage on essential medicine and some of the supplies. I mean, you talk sometimes about 30 to 40% shortages. So there was a lot of shortages as well. So yes, there is definitely shortages in a number of areas, in a number of fields. And what I said, the non-communicable diseases, for example, when you talk about oncology, dialysis, I mean, we try to help the ministry partners trying to expand dialysis, etc., being a real issue. The hospital I visited in the south, which is non-functional, Al Najjar, before the siege on Rafah, that had, for example, 600 dialysis patients, etc. And that was all gone. So there's a lot of shortages in the area of non-communicable diseases. Then on some of the specialized, the critical specialized medical fields, because of a lack of certain medical specialists and other areas. I'm more concerned though about the basic health services. Primary healthcare is the basis of everything. And that's with all the population movement, for example, from the south to the north, I mean, like more than 500,000, 560,000. And certainly the north is over 1 million people. It needs to be expanded rapidly. There's work. Not only do we show many partners, ministry work on that area. Much more is done, needs to be done. Basic health service, including what you mentioned, shelter. Completely agree with that. Currently on the emergency kits and let's say trauma supplies, I think there's a good stock now in Gaza. But we need to, of course, expand and stock up as much as possible. Fuel was always a problem. Fuel to hospitals and health facilities. Currently, at least all the partially functional hospitals and facilities, they do have fuel. And the ambulances as well. So that is approved. Is it sufficient? Absolutely not. Is it good? Absolutely not. It is, I think, but I think one thing, specifically the health workers and WHO and partners should be proud of. I always hear polio and the polio campaign. No, is that the health system is not completely collapsed. That we still talk about partially functional hospitals and then very much a little bit of a basic healthcare system. And now again, referral pathways. Now we need to expedite that and expand that. But there's many other, I would say, larger concern. You mentioned one. For example, the shelter, think about the children, think about education, and think about private sector, about jobs and work. There's so much, there's so many needs. I want to leave it there.
Pam?
Thank you, Dr. Peeperkorn. It's Pamela Falk from U.S. News and World Report. My question is about in 2024, the vaccination levels for measles was very high in Gaza. Where is it now, and is it possible to continue? And is measles, I understood that the vaccination effort was falling, needless to say, probably. But the second is, there was also polio discovered at late 2024 in the wastewater. Is there any follow-up on that? And are there levels of polio? Thank you.
Thank you very much. So I think coming back to the measles question. So first of all, yeah, Gaza and also in the West Bank, by the way, vaccine acceptance has historically always been very high. So the expanded program immunization was never an issue here. You always had coverage rates above 90%, actually much better than many high-income countries. And there was never a kind of discussion. Of course, with the crisis and the war, etc., that initially that struggles, that initially even collapsed, etc. But then this was very much seen as part of this, what I said, this minimum health package, like in the medical points, in the UNRWA primary healthcare facilities, in the other primary healthcare facilities, and these medical points. This was very much part of the action, and we are still analyzing that, a lot of data, but I think what we see that actually the EPI coverage, it definitely decreased over these 16 months, but not as bad as we thought. And I think that the measles was still close to 80 or 85% coverage, which is actually much better. Not good enough, by the way, I want to stress that. So it's this is part of the surveillance and the surveillance strengthening what's going on. We're looking at that, not WHO part, is that we're looking at that, and also how to improve that. Now, if the it's also if the part of the ceasefire holds moves to a peace process, those systems, those are, I would say, the easier systems to get back in place. Expanding the cold chain and cold chain activities and everything related to that. So critically looking at that, because it's very important that we keep these child vaccinations. But despite this devastating crisis and war, better than expected. And in polio, yeah, we keep monitoring on polio. You know about the first campaign. We keep monitoring the situation. Over to you.
Last question, Chris?
Dr. Peeperkorn, thank you so much for your time today. Chris Reyes with the Canadian Broadcasting Corporation. You mentioned the need for a strong World Health Organization, the need to focus on collaboration, not isolation. As the U.S. funding is currently being reviewed, as you mentioned and considered, how do you deliver this message to President Trump, who seems intent on questioning the value of the work of your organization and the UN in general?
Yeah, I find. I think I try to. I think I want to go back to the, and you might not like it, but I think that the general reply for we. I think it has been raised at all levels, that because we regret that announcement, and we really hope that this is being reviewed and reconsidered. And for me, I mean, like, and I think for all of us, I think global health has become so prominent over the last decades, and not just because of COVID. Global health and global health security. And we know that the US always paid very much attention to that, by the way. And many of their institutions were very much in the lead and assisting, etc. As I said, personally, I worked a lot with CDC in many different places on that. Now, so it's not just, for me, it's the funding, of course, it's important, but not just the funding, it's also the collaboration and coordination. That you help improve health everywhere. And that's if in one area, if in one country, the results of whatever, an health or a health system or medical treatment or medical treatment protocols are better functioning, you want to share that. You want to share that over the world. And you want to make sure that everyone benefits from that. And I think, for example, on the tail end, it took a long time with COVID, because I think in the beginning it was so There was so much inequity actually when it came to that. But on the tail end, it also showed what can happen when globally there is collaboration. Now, this doesn't apply just for epidemics and pandemics. It also applies for health emergencies. It applies for health systems in general. What we can learn from each other. How can we make the world healthier and a safer place? And there, again, we all have a role to play. and the US, I mean, as also a founding member of WHO, really played a critical role over the years, and a critically important role. And of course, we want to see this continue, and we want to see it continue in collaboration. And I want to be sure that I can collaborate also with my US colleagues, how I've done in the past, wherever I worked. And not just from their institutions and public health school, etc. So that would be my answer. And yeah, I think we have to really focus on collaboration and not on isolation, specifically when it comes to global health and global health security.
How do you deliver
Over to
that?
you.
How do you deliver that directly to the Trump administration, though, who holds the power, the executive order power, that would pull this funding?
Well, I think I'm probably not the person who will deliver that. I'm not. It's not my role. I mean, like that's, and I think there will be. I'm sure there will be many discussions from WHO with the U.S. administration and other countries, and for me, my role is now to inform you, and I'm sure that you will transform that message in the right way.
And with that, I'd like to again thank Dr. Rik Peeperkorn, the WHO representative in the West Bank and Gaza. Thanks very much, and have a great evening. Thanks. Good afternoon, everyone.
Thank you very much. Let's try. Bye bye.